So I want to talk about a project we've been involved with for the last 5 years, which was called the Canadian Cow-Calf Surveillance Network. I am not the only person involved in this. It's a huge team of people. So we had Dr. Waldner, my colleague at the U of S, who did an awful lot of work and is carrying on the project for another 5 years. Colleagues from Calgary, Guelph, Montreal, other colleagues from the U of S, and then people that do the real work. Charlene was kind of the research tech that helped keep everything going, and then tons of graduate students and who some are still working on their theses out of data out of this project. So thanks to all of them. I sort of was just the person trying to coordinate herd all the cats, I guess. Why did we get funded by the BCRC for this? I think there's a few reasons. One is that we're just trying to benchmark what's going on in the industry. We're trying to figure out what's normal, what's abnormal, what should we expect in terms of productivity, things like that. It also helps us identify where we need more research and what we're doing well as an industry, if we have some good news stories to tell to the public. And sometimes we figure out what we could be doing better too. So that's really the purpose of sort of animal health surveillance, is to look at those sort of topics. At the end of the day, we're probably not going to identify new diseases or things like that. It's the producers and the veterinarians out there in the front lines. They're the ones that are going to find the new things and identify the real issues. But we're just trying to put some numbers to some of those things as we go along. And you folks do it all the time, right? If you're keeping records, whether it's on paper or on the barn door or on a fancy computer program or a Excel spreadsheet, you're benchmarking, you're sort of tracking that stuff. And we were just trying to collect some of that data. So it actually started 5 years before this, in 2012. Our first project with BCRC, we did it just in Western Canada, so the 3 prairie provinces, about 130 odd herds, 125 herds across Western Canada. That's where they all were. I know that there's some of the people in this room that were producers that participated in it from Manitoba, and we really appreciate those folks that did that. Many of those people stayed on for another 5 years, so they've been warriors with us doing this as it went on. So it went so well, BCRC came back to us and said, hey, we want you to do it another 5 years, but we want all of Canada. So this is the herds across Canada we did. We overrepresented Eastern Canada a little bit just because they wanted some data from there, and if we picked sort of representative numbers of Eastern Canada, we'd only have 10 herds in Ontario and 5 herds in Quebec or something like that. So they're a little overrepresented compared to the Western herds to some extent, but we sort of mimic the beef industry pretty well when you start looking at the numbers across the Western provinces and then in the East as well. Well, we collected a lot of stuff from these herds. So we collected their production data every year. So we got some data from their calving records and how many calves died before 30 days of age, and abortions and stillbirths and things like that. And then we got weaning and pregnancy data. So how many cows tested pregnant, how many calves did you wean, just really basic stuff. It really isn't that complicated. It's always more complicated than you think it is, though. When you start asking people these questions, they say, well, I got this group of cows and they calve in the fall, and this group of cows, I breed them different because they're the purebreds, and it always is uglier than you think it is. And then every year we asked them to fill out a survey on a particular topic, on some sort of animal management issue. So it was animal welfare practices, antimicrobial use, vaccine use and technology adoption, and the last survey was on sort of biosecurity and pre-weaning calf mortality. So we got some really good information. We also collected some biological samples. So several times through the study in 2019, we got local veterinarians to collect blood and fecal samples from cows at pregnancy checking time, and we tested them for some various diseases. We looked at trace mineral levels, and we'll talk about some of those results in a minute. In 2020, we got some fecal samples from young calves to look at antimicrobial resistance. And then we got some samples in 2021 from weaned calves as at weaning time, again, some blood samples where we, again, looked at trace mineral levels and a couple other diseases. Just the logistics of doing that across all of Canada, you got to send sampling kits to veterinarians all across the country, and they got to collect them the way you want them collected, and they got to label them the way you want them labeled, and then they got to send them all back to Saskatoon and get them mailed back here, and it's January and it's cold and ugly, and you got to have coolers, et cetera, et cetera. So the logistics are sometimes daunting when we start the biological stuff, but we managed to do pretty well, and we had a lot of cooperation from the producers. So I can't talk about everything we learned in this study. There's too much, and I'd be here all day. But I want to talk about a few of the highlights. I'm going to focus mostly on the first one or two, and then we'll briefly touch on some of the other issues. But I want to start with what we found out about trace minerals and copper, selenium, molybdenum too, maybe a little bit, just because I think it's such an important issue for us here in Western Canada. So I want to talk about copper first. It's a pretty important trace mineral. We see copper deficiency in cows quite regularly when I deal with herds with our disease investigation unit. There's two kinds of copper deficiency. So the first one is just, we call it primary. It's just there's not enough copper, right? They're not getting enough copper, either in their supplement or in the forages that they're eating, et cetera. There's not enough copper there, so they have copper deficiency. So we see that. We have lots of areas in Western Canada that have low copper in our soils and in our forages, and so we need to supplement our cows appropriately. We also see secondary copper deficiency where some other mineral binds up the copper in the rumen. So that can be iron, that can be molybdenum, that can be sulfates in the feed or in the water. And we have lots of places in Western Canada that have high molybdenum in the soil, high sulfates in the water. We feed high sulfate feeds from time to time, like kochia, canola forages, especially in drought years where we might be going to those feeds. And some of the polycrops, newer polycrops, have pretty high sulfate levels as well. So all those things happen in Western Canada. It's maybe not surprising that we see a fair bit of copper deficiency. So this is a summary of kind of all the cow results we did over three different sampling periods. I got east and west broken out in 2019. And you can see that this is blood samples. So we just asked them to collect blood because it's hard enough getting vets to collect samples for us when they're preg checking to start with. So they just collected blood, which is not, we'll talk about whether blood or a liver biopsy is best. But if they're deficient on blood, they're really deficient. Okay? If they're deficient on their blood, that means they've used up most of the copper in their liver, and now their blood's dropping. Okay? So if they're deficient, I know they're deficient. So this is probably an underestimate of how many deficient cows there are. And you can see the first year in 2014, when we were just looking at the Western herds, 42% of the cows were deficient in copper. These are herds that agree to participate in a research project. They're probably better than average. They work with their vet. They probably go to meetings like you guys do, right? They're the better herds. And 42% of the cows in Western Canada, we took 20 cows per herd, so there is just over 2,000 cows in that population. 42% of them were deficient. It wasn't quite as bad in 2016. Those were younger cows, and that's maybe partly why we looked at first and second calvers that year. 2019, again, not quite as bad as that first year, but still, almost a third of the cows that we sample are deficient in copper. These are herds that probably aren't having major problems necessarily. It's everywhere in our industry. Eastern province is a little bit less so. So that's Ontario, Quebec, and the Atlantic provinces. If you go, so that's at 0.5 parts per million in the blood. That's what the lab calls deficient. And they use some references from back in the dark ages before I even graduated to sort of come up with those references. But if you go to the next level, they also have deficient, and then they say less than adequate. So if you just go up 1 0.1 part per million to 0.6 part per million, it's almost 2/3 of the cows in 2019 were less than adequate. That probably means they've used up a lot of liver because their blood's starting to drop, and they're probably if we had biopsied those cows, we probably would have found even more deficient. So it's huge. Copper deficiency is a huge issue. I think it's unseen in our herds. I don't think we know what's going on. It affects performance. There's no doubt about it. So if you like pictures, this kind of shows you the darker areas are where there's more cows deficient in copper. This is not soil. This is not forages. This is cows, right? This is cows. So the cows are eating the stuff, and all those interactions are happening in the rumen, and this is what's showing up. And of course, we're interfering. We're using mineral tubs and mineral supplements and free choice minerals in all sorts of different ways too, so that's affecting the pattern too. But this is the cows. And you can see there's some pretty dark areas there in parts of Manitoba, not very far from where we are now, southern Saskatchewan, up around Saskatoon. There's lots of herds there too that are copper deficient too. And up as you go north and get into the bush country, it seems to be a little more common there too. Here's the 2014 data, just the Western Canada. It's a little easier graph to see, but it's almost exactly the same. It didn't really change a lot between those 2 years. Again, the darker areas, those really dark areas are like 60 to 70% of the cows were deficient in those dark areas. All right, so that's deficient. That's like truly deficient. So it looks like it's not as big a problem down in southern Alberta, but there's a lot of it in sort of this neck of the woods and in my neck of the woods in around Saskatoon. We looked at molybdenum because it's one of the important trace minerals that ties up copper. So we measured molybdenum in the cows, and what was interesting is it didn't really explain the copper deficiencies. And I thought, and it also surprised me, I thought, oh, I'm going to see high molybdenum in Manitoba. You guys have high molybdenum in your soils, right? That's going to be where the problem is. It actually wasn't as big a problem in Manitoba as I thought it was, and I'll show you the graph there. There was, 14% of cows were higher than recommended, so it's an issue in places, but it didn't correlate really well with the copper deficiency in this case. Not sure how you explain that. About a third of the herds had at least one cow above the threshold. And again, if you look at the map, I know it's a little hard to see when I've got all of Canada there, but Manitoba, there's a little pocket up here. What's that, around Swan River maybe, in that sort of area. There's a little pocket up there, but for the most part, the dark areas are more southern Alberta, where we didn't have copper deficiency, right? So maybe up here in the north, there's some linkage between copper and molybdenum, but who knows? We also collected some samples in 2021 on calves at weaning. A little tougher to do in cow-calf herds because not everybody handles their calves at weaning time, and some of them just put them on the truck. So we didn't get quite as big a sample size, but it still shows up there. Almost a fifth of the calves we sampled were deficient in copper. About 73% of the herds had at least one deficient calf. Molybdenum, it wasn't quite as bad. Again, it didn't really relate to the copper levels. Selenium, which we always think is a big issue, is not probably as big in Western Canada as we thought it was. Only about less than 1% of the cows were deficient. There was 34% of the cows less than adequate, so it's still something to keep an eye on. But again, the geography of that, mostly around the foothills, and then way worse in Eastern Canada. Again, we're not measuring forages, we're not measuring hay, we're not measuring soil, we're measuring cows, right? It's very different. Most of the graphs you see are soil maps and things like that. This is like what's going on in the cows, which is impacted by management, obviously. We did it in the calves. They're a little bit higher issue in the calves when you look at them in weaning, and obviously, making sure those young calves get adequate selenium at birth is probably an issue, especially if you're in a selenium deficient area. Well, let's go back to copper because I think it's the biggest problem. We looked at a bunch of these other trace minerals and well, they're kind of at levels I'd expect, but the copper one was much worse than I thought. The big issue, probably with copper, is impaired reproductive performance. And as part of my job at the Disease Investigation Unit, I get to go to lots of herds that are experiencing big infertility problems. And I would say that low copper is one of the most common diagnoses that we make. And when I mean low, like they are super low, super, super low. And it's impairing reproductive performance. Now, what happens at kind of those, just less than adequate levels? Maybe they can do okay, but I'll show you some work that we did in another study that sort of looks at some of that. You might see loss of color, bleaching of the hair coat. These black cows kind of look a little reddish sometimes. You probably affects weaning weights in calves and milk production in cows. The other thing, though, it does is it affects the immune system. It impairs their immune system. It's necessary for immunity to work. They probably don't respond to vaccines as well. And the one thing that I see very commonly is that all of a sudden you see a parasite problem like coccidiosis in a group of calves or cows that you don't expect. They're spread out, they're not crowded together, things like that. And if you go in and look at them, often they're copper deficient. A vet texted me the other day. She had this yearling heifer that was, she's just over the border in Saskatchewan. She had this yearling heifer that was showing nervous signs. It just kind of had this tremor and wasn't doing much else, wasn't eating, had some bloody diarrhea, which is probably nervous coccidiosis, right? We see that sometimes in herds where an animal gets this nervous form of coccidiosis, which we don't really understand very well. Seen outbreaks of it in some places as well. It's hard to treat. They often die. So she phones me up and said, I'm seeing this. What do you think it is? And I said, well, it could be nervous coccidiosis. We talked about some other things and things like that. And I said, but why this one cow, right? Why a yearling heifer getting coccidiosis? And I said, if she dies, you should send some liver in and see what happens. So she did go on to die. She went down the next day and they euthanized her. They sent the liver in. She had 2.5 parts per million in her liver. Normal liver is 25 copper. She had 2.5. And I've seen that routinely in a bunch of other investigations where their liver copper is basically gone. Normal is 25 parts per million, and she was like a tenth of that. This is an old study that my colleague, Dr. Waldner, did in 2008. She looked at a community pasture, and she actually sampled these cows when they were going on to pasture pre-breeding, which is probably a better time to assess their copper status. It's actually better correlated with their reproduction. The y-axis, so this axis on the left here, is the open rate. So this means these cows were really, there was a lot of them open. I can't read the numbers, but it's like almost 90% of them were open. Okay, this is the copper value in their blood. Again, we just measured blood in this one because we're bleeding cows as they're going on a community pasture coming off the trucks. It's challenging to even do that. And then these are different age groups. So these are the young cows, and you can see once their blood copper starts dropping below 0.4 parts per million, the open rate just starts to skyrocket. It goes way, way up. The slightly older cows, kind of the middle-aged girls, the 4 to 9-year-olds, same thing, not quite as bad, right? And for some reason, the old girls, the 10 to 14-year-olds, I don't know whether we've selected them to deal with copper deficiency or what's happened, but they've seemed to survive in the herd, and they seem to not be affected as much down there. Now, there weren't as many of them as low in the really low values here, but you can see anywhere they get below 0.4, 0.5, somewhere in that ballpark. So maybe that cutoff for 0.5 in the blood is pretty reasonable, right? That is actually showing up in reproductive performance. It's hugely obvious. I think we're seeing huge open rates this year in herds all across Western Canada. It's a common theme. Some of it's drought and not enough feed and things like that. Some of it's probably copper. Some of it's a combination of things. So let's talk about dealing with it, because that's the next question. So feed test rules. Feed testing rules. I love feed testing. Do it. Manitoba Agriculture is probably telling you to feed test, use cow bites. But you cannot sort out trace minerals on cow bites. completely. You can get a vague idea, but you can't sort out all the interactions between sulfate and iron and molybdenum and all that sort of stuff. It's impossible. If I ask a nutritionist, oh, I got this much sulfate, in my feed, how much copper should I feed? And they go, well, I don't know, right? Probably more than normal, but they don't really know. So the only way I think you can assess your trace mineral status is by testing cows. And so that's my big mission before I retire, is to push more veterinarians into testing cows, to assess trace mineral status, to get an idea where you are. You might be great. I go into herds and I test trace mineral status, and they're fantastic. They're doing everything right. I don't need to tweak anything. It's good. Stop, right? I go into other herds where they think they're doing a good job, and it's terrible, right? And it might be because they have sulfates. It might be because something else. Well, we've got to tweak it. But the only way I know if it's fixed is if I go back and test cows again, right? You got to test cows. So you can do that with blood samples. That's better than nothing, right? If they're deficient on blood, they're really deficient, okay? Liver biopsies are probably the best. Talk about that in a second. How many cows do you need to test? I don't know. I want to know what percentage of cows are deficient. So I probably got to do 5 to 10 to figure out a percentage that's deficient, right? If I test 3 cows and one shows up deficient, well, yeah, I got 33% deficient. But if I took 1 cow away, I'd have 50% deficient, right? So, or 0% deficient, perhaps, depending on which cow I took away. So, yeah, I probably need to do 5 to 10 cows. I would do it pre-calving, probably, or at preg checking, maybe both. And then you got to tweak your mineral thing, and then you probably got to test again to see where you're at and figure out what's going on. Because you can't sort out all these interactions with the feed test. It's impossible. So feed testing is great for protein, energy, and all NDF, all that other stuff. You need to do that. I'm not saying don't feed test, but you can't sort out the mineral stuff very well. So the liver's the main storage depot for most of these trace minerals, especially for copper. That's where it lives. It's kind of like the freezer downstairs that you go up and bring the steaks out and put them in the fridge in the kitchen, right? And the fridge in the kitchen stays full until the freezer's empty, and all of a sudden the freezer's empty, right? And you're gone. You're out of steak. So this is the liver. Blood levels in the copper stay relatively constant as long as there's some copper in the liver. But once the liver's gone, then the blood starts to plummet. So if they're deficient on blood, they are really deficient. They've probably lost most of their copper in their liver. If they're normal on blood, I don't know. They might be fine in their liver. They might be getting low. I can't tell you for sure, right? So that's the downside of blood. But it's still not useless, right? If that's all you can get done, bleed some cows. Get an idea. I got a little video here. I'll just maybe get them to run that for me if they don't mind. Is there somebody over there? There we go. So this is I just actually took this the other day. I was out showing a couple of veterinarians how to liver biopsy. I have a special trocar that I ordered custom made that's a little bit bigger than the sort of traditional one they use, but then that means I only have to stab them once to get enough liver for them to analyze in the lab. I've blocked her, I've clipped her up, I've sort of prepped her, so that took a few minutes ahead of this, and then I just pop it through the ribs. It actually got to direct it kind of forward a little bit, and then you push it into the liver once or twice, 3 times, and you'll see I get a nice big liver sample. I have done thousands of these in the last 2 years. We had a big project on campus with Dr. Greg Penner. He had me liver biopsying all these feedlot animals multiple times. Some of them I biopsied 4 or 5 times. I didn't kill a single animal. Nothing looked backwards. If I can do it, anybody can do it. I'm a terrible surgeon, okay? And so here I got a nice chunk of liver there, and we're done. It takes very little time. I give them usually some Medicam, some pain control. If those cows were going to slaughter, but I would probably give them penicillin if I wasn't doing that, just to be safe. But you're not going to kill cows liver biopsying them. It's not a hard thing. Years ago, I did another project for Meg Smart and probably did 4,000 animals that year. And again, I think I've had maybe one animal have an issue, and it was probably because I hit a liver abscess on it, right, when I was biopsying it. So it's pretty rare. Just another thing, so I think one of the reasons, so we know free choice feeding or force feeding mineral is far, far better than free choice. Not every cow eats free choice mineral. And from this study, we did this at our Goodale farm at the vet college. We force fed half the cows mineral for 3 months, and they were 6 times more likely to have adequate copper when we sampled them in their blood at the end of that. If they got the force-fed mineral, they came into heat twice as fast, and they got pregnant 5 days earlier. Now, 5 days earlier doesn't sound like much, but over a big group of cows, that's significant. That's the difference between 65% of your cows calving in the first 21 days versus 40%, right, or 30%. That's huge, and that's another 40 pounds a calf, right, when you start thinking about that for that 20% of cows that calve later. And we know that pre-calving is a little more effective than post-calving. Like all things, it's tougher to catch cows up post-calving when they got those high lactation demands. So one of the things I think that has changed in the industry, when I first came to Saskatchewan in the 90s, everybody was bringing their cows into corrals and feeding them, and vast majority, right? And we could force feed mineral, or we could maybe monitor mineral a bit better. Now, so many of us are extended grazing, corn grazing, swath grazing, bale grazing, et cetera, and we're relying on free choice mineral for a bigger and bigger portion of the year. Not just the summer grazing season, but now we're doing it till January sometimes, right? And I think it's an issue. We got to figure out a way to drive mineral intake in those cows and worry about that, throughout the year, not just before they calve. We do have some new options now. So Multimin is a trace mineral injectable product that just got licensed in Canada. It's been in the States for a while. We've had vets bringing it in on emergency drug release for a while. It might be an option in some cases. So it's about, treat a 1,400 pound cow, it's somewhere in the neighborhood about $4. Gives about 90 days. It's got copper, manganese, selenium, and zinc in it. Those are the 4 trace minerals it has. It probably gets, it avoids, because you're injecting it, it avoids all the interactions in the rumen. It's probably a little slightly faster increase in liver copper than feeding it. But like all mineral supplementation, too much of a good thing can lead to toxicity, right? You can kill cows with copper. And I've seen groups of purebred bulls being fed too much supplement and dying of copper toxicity. You can kill cows with copper. You can kill cows with too much selenium, right? I had a vet phone me the other day. They had a group of cows that were severely copper deficient. She was thinking about using Multimin. She tested cows, though, and this was down sort of Maple Creek area. They were all really high in selenium. They were high normal selenium. And I'd be worried if she gave the Multimin, she'd push the selenium up too high that she might cause toxicity, right? So they had to come up with another option. So I would say, before you do anything, test some cows, get an idea where you're at before you start. Don't just start injecting cows 6 times a year with Multimin or something like that. You could create issues, right? Too much can cause problems. Okay, I'm going to move on to some of the other ones and talk a little less time about them. I wanted to spend the most time on that one because I think it's such an important issue. So I want to talk about Johne's disease because this was probably the other big accomplishment we made out of this project. Johne's disease is, many of you have probably heard about it. It's sometimes called paratuberculosis. It's this bacterial infection of the intestinal tract in cows. The bug has got this big long name, Mycobacterium avium paratuberculosis, and we just call it MAP, okay? So when I say MAP, I'm talking about the bug that causes this disease. It's a bacteria. It's got a waxy cell wall, so it survives in the environment for a long time. It's a terrible disease to try to get rid of in your herd. You want to keep it out if you don't have it. Animals usually become infected as a young calf. So an older animal can become infected, but most of them get infected as young calves. Their immunity's not as good. They're more likely to get it. So often they get it if their mother's infected. They'll very likely get it, right? But they could get it from another cow in the herd. The other thing that makes it tough to control is it's kind of this silent infection for the first 3 or 4 years of life. They get infected as a calf, but they don't show any signs until they're 4 or 5 years of age. Okay, often. Sometimes it can happen earlier, but often it's 3, 4-year-old cows before they start showing clinical signs. So there's this very slow-growing bug. It's got a long incubation period. It takes a long time to show clinical signs. It's easy to diagnose. Okay, it's 2 things. She's got this skinny cow losing weight, and she's got diarrhea that could thread a needle at 10 yards. Okay, so don't stand behind her if she coughs. And so it is fairly easy to diagnose, right? And on pathology, we see these thickened intestines. It's not a difficult diagnosis to figure out if you have it. Now, there's other things that can cause thin cows, right? So, just because you have a cow losing weight doesn't mean you have yonis, but that combination is pretty characteristic. So they have weight loss, they keep eating, they look happy or reasonably happy until they get too thin. There's chronic diarrhea that doesn't go away. Often doesn't happen until they're a bit older. Eventually, they become emaciated and waste away, and we have to usually put them down if they're not shipped or something before that. They get this thickened intestine. They just can't absorb nutrients, and there's no treatment. We have nothing to treat these cows with. They're going to die, right, eventually. So we looked at it in 2019. We looked at it before this as well. We sampled as part of this thing. We were bleeding cows. We can look at antibody levels in their blood to see if they've been infected with yonis. So we got just over 3,000 cows from about 160-odd cow-calf herds across Canada. And only 3% of cows were positive, which seems like, oh, that's okay. That's pretty low. And it's lower than the dairy industry. This is a bigger issue in the dairy industry, and that's where most of the research happens. And sorry about that. I'm having trouble here. This is just sort of saying, oh, we think the real level is somewhere between 1% and 7%. And in that was Eastern Canada. Western Canada was only 1% of cows, and that was similar to the data we got in the previous round that we had done before. So 1% of cows, that's nothing, right? The trouble is, somewhere between 15% of Eastern herds and 10% of Western herds had at least one animal positive. And remember, we only sampled 20 cows per herd. We didn't sample their whole herd. So that's probably an underestimate. There's probably some of the herds that came back 10 cows all negative that probably still had yonis in there, right? So 1 out of 10 herds in Western Canada have yonis disease in them. And that seems to be growing, I think, compared to our previous data. And that's probably an underestimate. It's a challenging disease to get rid of because the tests don't work very well. So we have 2 tests basically that we can use. We have a blood test that we used in our study. We use both of them actually. There's a blood test where we can look for the antibodies, and there's a fecal test where we actually look for the bug itself with a PCR test. Okay, so we have a blood test and a fecal test. There's also a culture test where they try to grow the one. Takes forever, costs a fortune, almost no labs do it anymore. Okay, so we'll ignore that. It's because basically you can't get it done, costs too much to culture it. So we use either this PCR on the feces or we use a blood test. We have 2 options, okay? So what we found out in this study, because we did both on a whole bunch of these cows, which had never been done in beef cows before. We had almost 3,000 cows, right? And we did both the blood test and the fecal test. And because we did both, we can figure out which test works the best. And there's complicated math behind it, which I don't want to go into. Bottom line is, the fecal test was far better at finding positive animals. The fecal test is far better at finding positive animals. It's a way better test. And before this study, I sort of said, oh, they're about the same. Maybe the fecal test is a bit better. It's actually incredibly better. The nice thing about the fecal test is we can pool samples. So you take individual samples from the cows, right? Submit them to the lab, and the lab will pool them in groups of 5 usually. And they'll test that pool of 5 cows, and if it's negative, they're done, right? They don't have to test them again. If it's positive, then they take the individual samples and test them again to figure out which cows were positive in that pool. So it saves some money, because I think this costs $40 to $50 a test, right, in that ballpark. So if you can save some money on it, it's quite a bit more expensive than the blood test, which is more in the $14, $15 a test. Okay, the blood tests are great still. They're useful. They can give you an idea if you have yonis in your herd or not, but they're not as good at finding the infected animals to try to eliminate them from your herd. Okay, the pooled test, actually, when you go from the individual test to the pooling, that actually gets a little less better at finding the positives, but it's probably worth it still to save that money. So that was new information that we didn't have before this happened. We have much better idea of how to use those tests in a diagnostic manner in our herds. And so that's resulted in this fancy computer model program that the BCRC has on their website. Your veterinarian can go in there, they can put in data for your herd, what the prevalence of yonis is in your herd from a test, look at different strategies for testing. Should we fecal culture them every year, or should we fecal test them every year? Should we blood test them every year? And over 10 years, it shows you what would happen in your herd based on those sort of things. So it's a really powerful tool that is there. It's a little complicated because there's a lot of math behind it, but the front end's reasonably easy to use. There's a bunch of videos you have to watch to kind of figure it out, but it's on the BCRC website. And that's all a result of doing that surveillance work in Western Canada. A couple other quick things before we end. I want to talk about antimicrobial use. And this is kind of a good news story that we probably need to get to the public about the cow-calf industry. So nothing probably very surprising to you folks here. Yeah, I think you could have come up with these sort of statements almost ahead of time, except you wouldn't have had the numbers behind it. Yeah, almost all the herds used antimicrobials at least once. That's not surprising, right? That we all use antimicrobials to treat sick animals. But here's some of the good news is Health Canada divides all the different classes of antimicrobials into categories depending on how important they are for human use, right? So category 1 are antibiotics that are really, really important for human use, and only 33% of the herds are using those category 1 antimicrobials. That's Xanel. It would be one of those antibiotics, the ceftiofur sort of products, Exceed, Xanel, things like that. So we're not using the category 1 antimicrobials a lot, right? We're kind of using them in the right order. You can see the category 3 ones, that's like the tetracyclines and stuff like that. They're like 94% of our herds are using them. That's what we're using the most, so that's really good. Most used antibiotics, oxytetracycline, fluorophenical. We probably could have guessed that ahead of time, but we wouldn't have had the exact percentages. That's percentages of herds that use them the most. And then we don't use a lot. We don't use them a lot within the herds. So most of the time, like 40% of the herds are treating less than 5% of their animals. So the cow-calf industry does not use a lot of antibiotics for the most part. 81% of the herds were treating less than 30% of their animals. And 88% of the herds were treating less than 70%. Now, there were issues. We're not perfect. 8% of the herds treated more than 70% of their nursing calves, right? They probably had an outbreak, had some wreck they're dealing with, right? Even in these well-managed herds. So there are issues there. 3% of the herds treated more than 70% of their wean calves. So yeah, there's things we can improve on. But by and large, we can say to the public that we're using antimicrobials fairly responsibly in the cow-calf industry. Why do we use them? Not surprising. You probably could have come up with this list. We use it to treat lame cows, foot rot. We use it to treat respiratory disease and diarrhea in nursing calves, right? So it's not very surprising. Do we need to use antimicrobials in all cases of diarrhea? Probably not. Right? Do we need to use antimicrobials in every case of lameness? They're not all foot rot, right? So there's probably things we could do a little bit better, but by and large, we can say that we're using antimicrobials pretty responsibly. If you looked at the factors associated with who used antimicrobials more, again, it wasn't surprising. It was if you had a respiratory disease outbreak in nursing calves, and a couple of things that always show up in there. People that use AI tend to get more respiratory disease in nursing calves. Now, why is that? That's bizarre. I'm using AI and I get more respiratory disease? It's because in an AI program, you're syncing cows, you're running them through the chute, you're grouping animals up, and there's usually young calves there, and they're getting put in a corral for a day while you're doing the synchronization program or doing the AI, et cetera. And that sort of conglomeration of calves, those kind of events, make it more likely that they're passing germs around and they're more likely to get respiratory disease. And that's shown up in countless studies. In the US, here in Canada, a couple of studies we've done, we keep showing that same thing every time. Doesn't mean you shouldn't use AI. It's just thinking about what you do with those baby calves when you separate the cows. Maybe you can keep them a little more spread out. It would help. Winter calving obviously is a bit of a risk factor for respiratory disease. Just again, young calves tend to be grouped together closer in those sort of situations. And then seed stock herds tended to treat more lameness than non-seed stock herds. So we were looking at antimicrobial use because we wanted to know, hey, we changed the rules. You had to buy antimicrobials. They're all prescription now. It really didn't change how, from our previous work, we're still using antimicrobials almost the same way. The most common diseases remain consistent. There's opportunities for improvement. There's things that we could probably do better, and I could get into that at another point, but we'll pass over that. We also looked at resistance. And again, it's another good news story. We collected both calves and cows across Canada. Now, this was a little smaller study just in Western Canada. We didn't use all the herds for this. Again, this is the percentage of animals that had E. coli in their gut that were resistant. The bottom line is we got some resistance to tetracycline. It's less than 15 to 20% of samples most of the time. There's some resistance to a few other antibiotics, but it's super low. Compared to other animal species, one of my old microbiology profs at Guelph, Dr. Prescott, who does lots of antimicrobial resistance, he goes, "Oh, John, beef cattle herds, they're pristine," he says. He thinks that our resistance patterns are very low. And we proved that again. So another good news story. Similar to other studies, we showed that calves tend to have more resistance than in the spring than calves in the fall. Not quite sure why that is. It tends to be mostly tetracyclines. Maybe we're using more scours medications in the spring and we see it more there. I'm not sure. So AMR prevalence is low. It's relatively consistent. We didn't see a lot of multi-drug resistance, and there was very little resistance to the really important antimicrobials. So it's a really good news story. Another reason for doing these kind of studies is that we can support statements to the public about how we use antimicrobials responsibly. I got to finish up here. Used vaccines, bottom line is we're using lots of vaccines well. Last thing I want to show you is technology adoption, because we talked about a lot of these things in this conference. Here's how commonly people are using different, embryo transfer, parentage testing. This orangey color or whatever that is the ones that are using it now. Some of these other ones are if they occasionally use it. So estrus synchronization, only about 15% of herds, 37% of herds using nutrition. We got lots of room for improvement in the use of technology. These are better than average herds, I would say. Cameras, 41%. There's not very many things over. Individual female production records, 70%. That's good. Ionophores in cows, calves. Hormonal implants, 18% in weaned calves, 31% in suckling calves. We talked about that with Kim and Betty in the other room the other day. So, we're not taking advantage of a pretty important production thing there. Last thing I want to talk about, production indicators. So this is the other thing we got from the production records. This is like 4 years of data from 150 herds or something like that, give or take. So each of these columns represents 500 calving seasons. 500 different herd, 500, some of those herds are represented 3 or 4 times, but this is 500 separate calving seasons. You could just look at the median. So let's just look at number of cows open at pregnancy checking. It could be, the median was 7% open, 6.8%. But you could look at the 25th percentile. The bottom 25% of the herds were bigger than 10.5% open. And the top 25% of herds were less than 4.3% open. So you can sort of think about where your herd falls in that sort of continuum. Are you in the bottom 25%? Are you in the top 25%? Again, this is 4 years of data, so there's multiple seasons there. Imagine the productivity gains and the greenhouse gases saved and stuff if we could move that bottom 25% up into the top 25%. So that's the other big part of this study that we got. So out of our first Western Canadian one, we showed that those producers that set goals and keep records, they get 60 more pounds of calf weaned. Why is that? Well, they don't just select their heifers by watching them run past the gate. They're selecting their heifers based on production records, right? Not just what they look like. We talked about that earlier in this conference. So thanks to all our funders, all the participating producers. Some of you are in this room. We couldn't have done it without you. We're actually recruiting herds for our next project, which has got a fancy, big, long name. I've put some brochures back on the front desk out there. If you're interested, you can contact Jace Fossen. He was one of the grad students on the original project. He's going to be the project coordinator this time around. It's a very similar study. Going to collect some production records, ask you to fill out a survey or two. There's an honorarium for the producers that participate. We pay a little bit of money every year to stay with us, and it's going to hopefully produce some of the same information. I have a podcast. It's kind of lame sometimes, but you're welcome to listen to it. So wherever you get your podcast, you can listen to that. I'm still learning how to do that, but it's out there too. I'm done. Sorry.
Thank you, Dr. Campbell. We have a few moments for questions. So do we have questions in the meantime? I know that there's been a lot of reproductive issues this year, ourselves included. And yeah, did you have your hand up, Graham? I did. I can always count on you to. Oh, look at those Tapleys fighting over the microphone.
My wife up here.
Dueling
Just
microphone.
thinking about blood sampling cows, is there, like the one graph you showed, it seemed like those younger cows are quite a bit more sensitive to a deficiency.
Yes.
Would you recommend sampling those younger cows specifically, or do you take a sample set of your whole cow herd and treat the whole cow herd accordingly?
I would probably try to focus on the 5-year-olds and younger, right? I wouldn't just take first calf heifers necessarily, because they might not be representative. They haven't been on the mineral program that your cows are on, so I'd probably, 2 to 5-year-old cows sort of in that ballpark would probably be best based on that information. Yeah, it's a good point.
We're part of the group that does have issues
Thank
with open
you.
rates, so that was a great presentation.
Thank you.
We do have the vet book to do some blood sampling next week, actually, just by
Great.
chance. I have a question kind of out in left field that has nothing to do with that.
Okay.
You mentioned foot rot, and a lot of times it's not foot rot. We do have a lot of problems with sole abscesses, especially in our bulls. Do you have any suggestions on what to use to treat for that, or how to kind of prevent that? Because that's a real horrible thing to deal with.
Yeah, treating it's tough. Really the only thing you can do is trim sole abscesses out and deal with them by getting them in a trimming chute and dealing with it. Preventing it, sole abscesses often, they've been laminitic for some reason, not always, but sometimes it's laminitis that you've pushed them too hard with grain maybe. So that's one potential one. The other one we've seen sole abscess is just rough surfaces, where there are lots of stones and lots of stuff that they're walking over. And so that's always harder to improve in cattle that are outside. Those would be the two big risk factors. There's probably other things, so that doesn't explain all of them. But watch that you're not over-conditioning bulls and pushing them too hard with grain would be one big thing. That's the big driver in sometimes.
That excuse me, that technology adoption slide was a bit discouraging.
Yeah. Yes.
And I looked to your podcast to fix a lot of that, but what organizations do you see contributing to that, improving that, or how are we going to fix that?
Yeah, I don't know. Like it is amazing how many years have we had implants, and that's probably better than average. I bet you if I sampled all the cow-calf herds in Canada, it'd be more like 15% of them, 20% of them. So these are the better than average herds that are working with the vets, and still only 30% of them are implanting any calves. So that's an easy one. Now maybe some of them have other markets and are fitting some of those niche markets and with unimplanted animals, that there could be reasons for some of them not doing it, but I expect that's a minority. So I don't know. Yeah, I don't know. It's like, how many years do we have to preach about those things before we get people to do them? Maybe we've got to have more field days and stuff on sort of basic stuff like that. And I mean, some of that stuff's more important than drones, I think, to be honest, right? Drones are cool. I like drones. I'd love to have a drone, but I'd rather get people to implant calves before they bought a drone.
With Yonis, you mentioned that the map can persist in the environment for a long time. What are some of the non-animal to animal vectors that would spread? I'm thinking particularly of manure management.
Yeah. So that's the one thing in dairy herds, where it's a little more intensive. That's maybe a bigger issue, but it's a good question. You don't want to use the same front end loader for scraping manure as you do for feeding, right? Sort of basic stuff like that. There's potential for it to persist on manure, fertilized forages and things like that, although I think that's pretty low. So the big issues are probably animal to animal. All the things we do for calf scours are important for Yonis, right? Because we're basically trying to minimize the amount of adult feces that calves are exposed to for both diseases. So using the Sandhills calving system or having a separate wintering area after they calve, not having them in confinement and trying to minimize the use of the calving barn. All those sort of things become super important for animal to animal transmission and are probably more important than some of the other things in the cow-calf industry. In the dairy industry, where it's more intensive, we have to worry about those other issues probably even more. It's a good question. Thank you for asking that.
On the Yonis front, I know what your answer is going to be. What are your thoughts on bringing in a nurse cow from a dairy herd?
Yeah.
Stop it.
Yeah, exactly. Don't do it. I mean, there's so many issues, right? So we actually showed in our first study, Trent Wennekamp, he's a veterinarian in Lloydminster. He did his graduate work while still practicing and has got 4 boys, and he's amazing. Anyway, he looked at biosecurity and things like that, and he looked at purchasing cattle on farms. And we all do it. We all buy bulls. Nobody's closed. There's nobody here that's closed, right? But he showed that the more adult cattle you buy, so that's bulls, that's cows, the more likely you are to have outbreaks of respiratory disease and scours in your calves. Okay? Buying adult cattle into your herd is a risk factor for neonatal diseases. Okay? So if you can minimize, you still got to do it, right? We still have to buy we have to buy bulls. We have to do things. We can't completely be a closed herd. It can't be like the swine industry and shower in and shower out, right? It's not the same, right? So I'm not trying to say that we got to be closed, but if you can minimize the number of sources that you bring in, it's huge. And if the sources you bring in are not in the witness protection program, that's even better, right? Because the cows that comes through the ring that you don't know where she came from, that is the witness protection program for cows, all right? You don't know what she's seen or what she's carrying. And Yonis is one of the worst ones to bring in.
I got to use that in my next presentation. That's pretty
I have
funny.
stolen that one,
That's
so I
excellent.
can't take credit for
What
it.
is your recommendation then for, you sometimes can't get away from buying cows, the quarantine period? Dedicated water source?
Yeah, it's a good question. To be honest, it doesn't help that much, quarantining arrivals. It probably helps a little bit for some things. If you want to get them vaccinated and dewormed and things like that, then probably you need a couple weeks quarantine. But for things like Yonis disease, for BVD, for a lot of those sort of diseases they're long-term, they're infected for life. It doesn't matter how long you quarantine them,
Yes.
right? They're still going to be infected when you turn them in with your herd. So for some of those things, it doesn't matter. For for some parasites, for some really acute respiratory disease things and stuff, probably a couple weeks would be lots.